Hi, I'm Dr. Pennau. I'm an oral and maxillofacial surgeon at Oral Surgery Associates, Colorado Springs. The opiate crisis is something I like to discuss. It's certainly become more prevalent in the news and it is reality. Unfortunately, people are succumbing to addiction and some of those people are not being able to survive. We take that very seriously, and I deal with a lot of young adults, and when we talk about taking out wisdom teeth, people in the past have always associated it with taking pain medication. What are we doing to help prevent that? One thing is a new medicine that's come out in the head and neck in the last year or so is called Exparel. Exparel is a local anesthetic that has been placed into a new carrier. That carrier allows for a slow release of that numbing medication over approximately 3 days' time. So while you're asleep doing your sedation, it is injected adjacent to the lower wisdom teeth sites, and what it does is release a numbing medication over the 3 days immediately post-operatively, and you get significant reduction in pain. It doesn't change with swelling and stiffness and things like that, but it definitely reduces the pain. A lot of patients now are requiring minimal, if any, narcotics post-operatively. Again, as I said, I take it very seriously to reduce the exposure of young people who are having impressionable minds to the narcotics. Exparel is a medication that has been out for approximately 6 or 7 years in the orthopedic surgery realm, but it has only recently moved into the head and neck. And I think a primary reason for that is to combat the opiate crisis that we're having. Technically, the FDA still has not yet approved it for under the age of 18. However, it is a very safe and effective medication. We still can use it under 18. I just have to inform you that it is off-label as of now. My presumption is that the FDA will certainly see the effect of it and the decreased opiate exposure to young people and start working on approving it as an on-label product for under age 18. There is a slightly additional cost to using the Exparel, and it is a relatively newer medication. There is a small expense that does go along with it, but that cost, I think, is very negligible compared to the risk of exposure to the narcotics at a young age. The cost of an opiate addiction or overdose is astronomical and immeasurable in money, and that's something that we want to avoid at all costs for our young people in this town. We really genuinely care about the safety and well-being of the patients in this city and all of the patients that we treat. If you have any questions or you want to know more about this, please give us a call. We'd be happy to talk to you and meet you and schedule a consultation.